Hello, in today's video we will be learning how to attach and start tube feed as well as giving medications through a PEG tube. So to start, I want to preface by saying that any medication administration related to the 10 rights and the 3 checks, please refer to Lindsay's video on the specifics of medication administration. For this video, we will be focusing solely on the skill of how to crush and give meds through a PEG tube as well as hooking it up to tube feeding. All right, so as always, we will start with our hand hygiene. We will provide for privacy. We'll ask our patient their name and date of birth. Can you tell me your name and birthday?
Yes.
This is Katrina Taylor. I'm verifying on her wristband here, and her date of birth is XXX, which matches our MAR and our physician orders. We have orders for, say, NPO with tube feed. They're getting Gevity 1.5 at 17 mils per hour with a free water flush of 30 milliliters every 4 hours, and as needed. We will demonstrate how to set that up momentarily. We've gotten a recent set of vital signs because she is due for metoprolol, a multivitamin, her erythromycin, and some Tylenol if she needs it. Her temperature is 101.2, so we are going to be giving that Tylenol today. One thing that we want to make sure we're paying special attention to is that these meds can be given crushed. So I'm looking at our multivitamin. It says EC, or enteric-coated meds. So that means that we cannot crush this medication. So we will be calling pharmacy and or the physician and seeing if we can change that order to something that can be given via PEG tube. So we're going to hold off on that multivitamin for now. Looking at her metoprolol, it says hold for a heart rate less than 60 or a systolic blood pressure of less than 100. She is good. All of her vitals are good besides that temperature, of which we will be giving the Tylenol to treat. So the first medicine that we're going to prepare is the metoprolol, 50 milligrams. So again, we're going to be doing all of our checks and rights when we pull these medications. And here, metoprolol drawer 6, pocket 2. Alrighty, we're verifying our dose, 50 milligrams, 50 milligrams. We have, again, verified with pharmacy that this med can be crushed. It is good to be crushed, so we're going to demonstrate the crushing and giving of a medication first. Let me grab some gloves. All right, so we've already done our hand hygiene. Again, we've done all of our checks and our rights. We've scanned the patient. These are the correct meds that we have. So our metoprolol, we're going to put in our pill crusher. And then give this a good twist to crush that medication. Alrighty, I have a little bit of water here. I like to pay attention because a lot of these patients are on strict I's and O's. So I have exactly 400 milliliters of just sink water. Doesn't have to be sterile. So we're going to pour just a little bit of our 400 milliliters into this med cup. Pour in our medication, and I'm going to ask my CNA to please bring me a spoon or a straw to stir and help dissolve this medication. And I like to start with my crushed meds first before we move on to liquid suspension meds. Thank you. So that way they can take a minute to dissolve. So we're just giving that a quick mix, setting that off to the side and giving it a second to dissolve. Now we're going to go ahead and move on. We have erythromycin. This is an antibiotic and it is a capsule form. So we'll show how to do that. Again, drawer 8, pocket 2. Erythromycin, 250 milligrams. We have an order for 500, so we'll make sure and get 2 of those. Perfect. Doing all of our checks and rights. And again, getting another med cup. Whenever we give medications through a PEG tube, we need to make sure that all of our meds are given individually. So we cannot mix 2 medications into 1 cup. We get a new cup for our next med. Pour in a little bit of water. Okay. And then these capsules, you just undo the capsule, being very careful over your medication cup if it catches any spills. And pouring all of that powder in there. There's a lot more in there than you think there is. Okay, and then that can just go into whatever your hospital policy says. Same for the second pill. Perfect. Okay, and we will give this a little stir and let that be dissolving. And again, we've verified with pharmacy that it can be given this way. Just being a little stubborn. Okay, that's better. Alrighty. So we've got those 2 meds. The last med to give is the Tylenol liquid suspension med. So since that is a liquid, it will be in our bulk meds. So we have it here. Our order is for 320 milligrams, and we have a liquid suspension of 160 per 5 mLs. So pretty easy math there. That's going to be a total of 10 mLs. One more med cup. And these handy dandy med cups have our milliliters on them already, so we're going to use that to measure. Okay, 10 milliliters. Perfect. All right, and now we're ready to do the medications. These have had a little bit of time to set and dissolve while we've been working on preparing the others. So as always, we'll scan our patient, scan all of our meds before we give them. We've gone through all of our checks, all of our rights, and we're ready to administer. Okay, I'm just gonna undo your covers here so we can get to your peg tube. Alrighty, it's important to make sure that the patient is always sitting at a 30-degree angle at least. And your beds usually have a degree marker on them, and we are at 30 degrees, so we are good. What I like to do is take the plunger out from the back of my irrigation syringe, and I will hook it up to the peg. And before we can start giving meds, we need to make sure that this flushes well. So again, we had a total of 400 milliliters in here when we started, so I'll know how much is administered at the end. Okay. On a real human, this should go in over gravity, but since this is a mannequin, I'm gonna give this a little bit of a push for time's sake. Can I have my CNA get me a new glove, please? All right, so that flushed, we're good to go. I'm gonna pop that, take this out. I'm gonna pop the plunger rack out. And now we're ready to give our meds. So we're giving these one at a time with a flush in between. Thank you so much. Okay, so we've flushed. We're gonna go in with our metoprolol first. Make sure that all of that gets in there. Come back with a little flush. Again, on a real human, this would go in much faster. So we're gonna give this a little push for time's sake. Okay. Going in with our antibiotic next. Giving that a flush. Okay. And then last but not least is our Tylenol. Putting that in and then coming behind that with a flush. Okay, we want to make sure we're assessing our patients during this whole thing to make sure that their bellies aren't getting too distended, that they don't get nauseous or vomiting. Okay. All right, we'll put our cap back on there. All right, and that is medication administration for a PEG tube. Now we're going to switch over and show you how to program the tube feeding pump. Alrighty, so now we're going to work on setting up our tube feeding and programming our pump here. So again, we're looking at our provider order, and we have an order for Gevity 1.5, which is what we have here. And then again, this is just sink water that we have going into our flush. So the great thing about these pumps is that we will use the pump to prime it, but you want to make sure that you're still over a garbage can until you get it all the way to the end before hooking it up to your patient. You do not want to put any air into the abdomen. Okay, so how we're going to load this, it's pretty straightforward here. You're just going to follow whatever directions are on the side of your tube feeding. We'll slide that in here. Alrighty, and now we have the setting to prime pump. We'll take the cap off, and then we'll just press and hold to prime feed over the garbage. There she comes. And it's giving you an alert on the pump that says disconnect from patient before priming. That's why we are over the trash can. Almost there. Perfect. All right. So now we can hook up to our patient. We've already come back and flushed since we just gave our medication, so we know it's patent and it's working. We have the patient at least 30 degrees. All right, and now we will do the programming. Okay, so again, following our provider order here, it says continuous at 17 milliliters per hour with a free water flush of 30 milliliters every 4 hours. So we're going to adjust our feed, click feed rate, and our rate is 17. Alrighty, and we'll push enter. And then our volume to be infused is whatever your bag of Gevity or your orders say. We're just going to put, for this video's purposes, 50 here. Alrighty, and then we'll hit done. And now we're going to go ahead and adjust our flush and get it ready to go. Our volume is 30 mils, so we want to make sure we program that to 30. Oops. And then our flush interval is every 4 hours. And enter. All right, and now that we have our rates verified, we can push run, and we have our patient up at 30 degrees, so we are good to go. And that is how we give medications through a PEG tube, as well as hook up and start tube feeding.